Hello, I am here live and we are working out a couple of technical difficulties because we are also going to be on TikTok. And we are going to be joined by Ag, and we will invite her and see what happens here. And it looks like we are live. We'll see if Ellen joins us. There we go. Okay, we're going to try that again. Invite. All right, so for those of you who are just joining us, we are doing a live Constipation Nation live with Hey Poopy host Ellen Stagg, who is a longtime friend of mine. It says she's unable to join, so hang on. All right, well, we'll try to invite her one more time. I know, Heidi, you were on it. I think you were on it maybe once or twice. Heidi is from Exonics, and there we go.
It's working.
Yay! Hi, Ellen.
Hi. I
How
love
are you doing?
call me a friend because, to be honest, you saw my butthole before our friendship started.
You're right.
I when I was reading your fabulous book on vacation, people were
Yeah.
like, "Why are you reading that?" And I was like, "Well,"
It's a long story.
I was like, "My friend and colorectal surgeon, who's seen more of me than most human beings have."
Oh, I mean, it definitely is a conversation starter with that title, I will say. But
Right?
I am proud that you were proud to read it on vacation because other people are like going to the library and they check it out and they're like, sneak it in their handbag and like.
I was sitting by a pool reading this. Ooh, this is great. Pool, sitting by a pool reading.
Oh my goodness. Oh, well, Ellen, you look great.
Thank you. I put on a little makeup because if I'm going to be live, I might as well at least try to put some effort in.
Yeah, no, the West Coast is doing great things for your skin. Okay, no, so Ellen Stagg, all right, she is the previous host of Hey Poopy podcast, of whom we just discussed. I've seen several parts of her. We, I think you first saw me as a patient before I knew about the podcast, right?
Yeah, yeah. I
Yeah.
came to you because I had horrible hemorrhoids, and you were like, and I went to one doctor at first who wanted to ban them, and I was like, no banding, please. Is our mutual friend, Dr. Evan Goldstein. He was
Yes.
like, do not do it, do not
Yeah,
band.
that's
I
right.
was like, okay. And so I was bleeding, and I then saw you at Mount
Yep.
Sinai in New York City. And I was telling you, I was like, I'm bleeding. I think it's hemorrhoids. I'm not quite sure. And you're like, let's do a flex sig. And I was like,
Yeah.
okay,
Oh, right.
wait for that. And to
Yeah.
figure out, like, yeah, I feel like you and Dr. Goldstein both have said, oh, we see trauma there, but it's okay.
Yes. Yeah. Actually, I mean, I remember now, and it's funny because like these days, I probably would kind of go the other way and be like banding is a good option, but from what I remember, you're like this typical like thin lady hemorrhoid, I call it, because in thin women you have almost like this like thinner, delicate skin. And I see it a lot where it's just like just super delicate. Not that, the person is delicate in any way, but the skin is delicate, and so anything that kind of goes through it just starts bleeding. And either banding or a topical ointment, or these days I actually treat some of those with a laser.
Oh,
Mm-hmm.
well, I need to come and visit you and your lasers.
Yes. Laser hemorrhoids. Anyway, yeah, no, so I'm so glad. I'm so glad you want to talk to me about the book. And I know you have a list of questions, but the book we're talking about, Constipation Nation, it was published in November. I'm still peddling it at this point. It's sold over 1,000 copies. Like, I'm surprised. Like, it's not 10,000 by any means, but 1,000 hands is pretty good, or 1,000 butts that we're helping.
Especially the climate where they're banning books, so at least people are getting your book.
Exactly. No, I can't complain. But yeah, I mean, whatever you want to do. I know you had a list of questions, and what I'm trying to do is we have some help looking at what questions are popping up so that
Okay.
we can, answer other people's questions or the list of
Yep.
questions that you have.
Yeah. I mean, I loved your book. I have to say, I also love that you trademarked that your neighborhood colorectal surgeon, your friendly neighbor. So I loved it, and I'm telling a lot of people about it. I feel like this is not only a fabulous stocking stuffer, but it could be a great Mother's Day or Father's Day gift because
Oh, there you
everybody
go.
deals with constipation and hemorrhoids. And
That's
as I have known from the podcast, but as this book basically says, constipation brings on hemorrhoids. It's
mm-hmm.
and none of them are a problem, but you
Yeah.
cause them by straining and sitting too long. And because I've had many a hemorrhoid problem that you helped me with.
Yeah.
And I haven't had really a hemorrhoid problem since you've seen the inside of my butthole.
Oh, that's
So,
good news.
yes, 3 or 4 years ago.
But actually I wanted you to like also like introduce yourself and brag a little bit,
Oh,
because you have to brag a little bit.
well, I'm Ellen Stagg. My day job is a photographer, and my passion was Hey Poopy podcast, which
Mm-hmm.
I'm looking into possibly bringing back with a different co-host.
Oh,
But we will see how that goes. I've been
I
very
have a
busy.
co-host for you.
Oh, I will. Yes. Oh my God. Yes. You should be my co-host too.
Well, I'm
I
like
have a
I'm not as photogenic as you, but yeah,
no, but
I
I
know
have
a
a
thing
comedian
about poop.
here in New
Oh,
York that he would do it with me, a gay male comedian.
oh, awesome.
But we should like figure out a way to like ask your friendly colorectal surgeon a question, and
Yeah.
like bring in on this is what a professional says. And obviously never, ever, ever take medical advice from anybody on a podcast or an Instagram live.
Right.
Do not do it. Even if we
Absolutely.
have a professional here,
You
please
are
go
correct.
study a doctor. And
Yeah.
you keep saying that throughout your entire book. You're like, yes,
100%.
I am a doctor, but still you want to make sure you're doing your due diligence and
Yeah. Yeah.
getting everybody, to help.
No, I think part of it is like, I want people to be educated, but at the same time, it's like you can be educated, but you're still not like seeing your own condition, objectively, I would say. And then that's why you go to a doctor, that's why you go to an NP or a PA, because they can examine you and, with their, medical knowledge, actually make a diagnosis that, you might be tempted to self-diagnose via Dr. Google or Medscape or whatever it is.
Yeah, and be your own advocate, of course. Like if you
100%. Always.
see
Yeah.
blood anytime you're using the bathroom, yes, speak to a doctor. It could be hemorrhoids, but it could be something worse. So you need
Yeah.
your friendly colorectal surgeon to talk to in person in a doctor's office about it. So
Exactly.
yes.
Yeah.
So
Oh, well, I
I
mean, yeah, go ahead.
like thoroughly enjoyed your book, and I wanted to start off with, I know you used to live in New York, but you moved, and I the last time I spoke to you, I realized you moved because you had a baby. And I
Yeah.
love how you brought your pregnancy into the book, because I think pregnant people go through all kinds of constipation and hemorrhoids and
Yes.
all kinds of problems. And somebody like you, who you said even in the book that you have never been constipated except for during your
And
pregnancy.
exactly. Yeah.
Yeah. And I think for even anybody who's trying to make a baby, they should get this book and read that part, because you actually went through it.
Yeah.
And yeah.
No, for those of us just joining us over here, we're talking with Ellen Stagg from Hey Poopy Podcast, and we're talking about, I think it's chapter 10, pregnancy and constipation. Maybe it's 9. And you're totally right. Like I have to be the first to admit, like I never really was constipated in my life, or at least not in my adult life that I can remember. Lucky that way. But I did really get constipated during pregnancy, and it was the very typical like first trimester, or all your hormones are out of whack, and plus I was on IVF, so there was like extra hormones there, and so I did get constipated. I followed my own advice though, and was like drink more water, bulk up with fiber, and as much as possible like stay active. And honestly, it did work after a few days. I did take a couple supplements, so I did take fiber supplements instead of just eating fiber, and added a probiotic as well. And then there's always the third trimester constipation, which is because of, again, the hormones, but now you also have this like, this baby in your belly. There's your entire abdomen is stretched out. There's this like huge intra-abdominal pressure, and all of that contributes to sitting on your sigmoid colon and literally not being able to poop. The other things that don't help are you get full faster, so you're not eating as much, right? So you have like heartburn and you're not eating as much. So I actually see, I think about right now it's like 20% of my patients are pregnant women, like either pregnant or postpartum, at Hemorrhoid Centers of America, because literally all of them have hemorrhoids. And a lot of it, you're right, is like counseling before you get pregnant to be like, hey, if you're going to get pregnant, you can wait until after you have the baby to get your hemorrhoids treated. It's like we
Yeah.
can kind of do stuff in the meantime to make you more comfortable. But, if we're going to band, if we're going to cut, we're going to do anything, most of the time you can wait until afterwards, because they're just going to get bigger in pregnancy.
Yeah. And as we know, especially talking about pregnancy, every baby is born with hemorrhoids. Hemorrhoids is
Yes.
a weird term to them, where people think they just audit like all of a sudden appear. No, the
Right.
hemorrhoids, I describe it to people as I'm like, hemorrhoids are like the airbags to your rectum
Yes.
that
Yes.
protect. So they
Yes.
fill up with blood to protect when poop is coming out, and then they deflate. And
Yes.
so every human being has hemorrhoids. It's when they have become, I don't want to say infected, but then they become swollen and aggravated from
Yeah.
sitting too long and pushing
Correct.
hard. During pregnancy, especially when you're giving birth, you're going to be pushing.
Right. Yes.
Things like
No, and that, I mean, I love that actually, like the airbags. I always call them like cushions or pillows, because they do kind of cushion the rectal walls, and they form like 10 to 50% of the anal continents, and they allow the poop to slide through. But people will often be like, "Oh, I feel like I'm kind of obstructed because my hemorrhoids are swollen." And whereas I used to say, that actually can't be true because the hemorrhoids squish. Now that I know, after I've done this a little bit longer, that you can have that feeling, that swollen feeling of like, incomplete evacuation just from them being swollen all the time. So, but yeah, I like that. Airbags to your rectum, or airbags to your anus. That's going in my next book.
well, you're welcome.
Thank you.
Um, but yeah, so I thought that that was really important. I had a friend of mine a couple of years ago, when she gave birth, she was the one who told me about kiwis. And she was
Hmm.
like, she was trying to find natural laxatives that would be okay for her pregnancy. And I
Right.
started eating kiwis. I don't eat them frequently all the time, but
Yeah.
when I eat a kiwi a day, I am good to go. Like,
Yeah.
so, and you have that in your book too. So I think it's important for expecting mothers or
Yes.
anybody. Yeah.
Yes. I mean, kiwis are like one of the only proven fruits to to actually, be proven to work for constipation, like 1 to 2 kiwis a day. Whatever, green kiwi, yellow kiwi, golden kiwi, it doesn't matter. But those have been proven to work. The other ones that work pretty well, even though there's not as much evidence, are obviously prunes. And then, the ones that I call like the 5 Ps, which is pineapples, plums, pears, um, papaya, and then the last one is uh, okay, pitaya is actually one. Pitaya is also called dragon fruit, but the one I'm thinking, oh, prickly pear. Prickly
Oh,
pear, the cactus is actually very well known in a lot of like South American cultures for constipation because it's a ton of fluid and a ton of fiber.
talking about knowing stuff for a long time about constipation, there were two things in your book that really stuck out to me, and it was Lewis and Clark's expedition and taking what they call thunderclap. And I've
Yes,
literally told so many people about this fun fact. I'm like, if you need a fun conversation starter at a cocktail party, this is one for you. And how the thunderclappers were a mercury substance, a pillar
correct.
that they
Yes,
would take every day.
yeah,
So they were giving themselves mercury poison, but it was to prevent themselves from having constipation.
right.
And you said that in the book that they can track their entire expedition across the country because
Yes,
this doesn't dissolve, it doesn't compost.
right, right.
And they literally can see every time they took a poo
Yeah.
on their trip where they were because of mercury.
Isn't that funny? Like, I actually think
It's
that
insane.
the historical parts of the book were like my favorites to research and write. And yeah, the thunderclappers were mercury pills. They took them because it literally causes mercury poisoning, which causes you to have explosive diarrhea. And their diets when they were on the expedition were mostly like deer meat, right? And so like, there was no fiber or like fresh fruits and vegetables at all. So they would have to take this to even go to the bathroom. And it was amazing. It's amazing because like mercury doesn't degrade, so it stays in the soil forever, and they track the entire thing, based on the mercury pattern. Yeah,
It's insane.
kind of
Like,
kind of cool.
yeah, if somebody was at like they were like it's still there, and I was like, yeah, that's what mercury does, it doesn't leave.
It
But
doesn't leave.
in that, I've had a question. Does it seem like during that period of time people were so obsessed with constipation? Do you think
Yeah.
that people were more obsessed back then than they are now? Like, because
So,
maybe we don't talk about it now enough.
I think it's funny because I initially did think that people were more obsessed about it. Like at the turn of the century, people were like, oh, okay, you have to go to the bathroom every day. You have to have a soft bowel movement. And they did all kinds of crazy things to do so. Like literally, these snake oil salesmen would go around being like, this will work for constipation. This will, and and that included things that were like literally like a like little mechanical punching thing that would punch your abdomen to make you go to the bathroom, or you would walk on like a little treadmill, like a little oscillating platform, like the one that Nikola Tesla invented, and then all kinds of things that you would ingest to go to the bathroom. So it was all in the news, and so part of me was like, oh yeah, it really was more prominent then, but I also think it was a little newer then, right? So when I look back and I actually tried to Google trend it when I thought about it, um, the trend has actually been fairly stable for people asking questions at least since the internet about constipation. So like for the last 24, 25 years, it seems to be more seasonal than anything. Like people will ask more questions in the winter when they're constipated because there's like lack of like fresh fruits and vegetables and diets, or more when people are
Or
sick, like
exercising as much.
not exercising as much. During COVID, people were sitting at home and eating junk food, and that went up a little bit. And so slowly, the trend has actually been going up over time. In the last 5 years or so, people are getting more invested and interested in digestive health. But compared to like the 1800s, I think it's actually about the same, which is kind of interesting.
Yeah.
I do think we should talk more about it in general, but it's also like kind of some like always there, like your podcast, it's like it's always been there.
Yeah, I have a newer partner as the past year and a half, and he's somebody we always like check in. Did you poop today? Are you okay? How many like you should
Yeah.
see the poop I just made. It's massive. So yeah, I think we should have these conversations with our loved ones, with our
Yes.
friends, checking
Yes.
in, just to show them it's okay, it's normal. We all do it, and
Yeah.
it's okay to talk about it.
And now that I have two little kids, I try so hard to normalize it and be like, hey, we're not gonna change your diaper and be like, oh, pew pew, it's stinky. We're not gonna be like, ew, you have to poo again, it's stinky. Don't do that. Because another part of the book was like about poop shaming and about how when we potty train, we're all taught to kind of be like, hold your poop, kind of don't poop until it's a little more convenient time, or when you do poop or fart, it's all stinky and it's like undesirable things. But when you think about it, that's so crazy because everybody poops.
Yeah,
It's
there's a
such a
book
human
about
function. There is a book about it.
but like that's why I love that part of your book too, because that was something that I used to talk about on the podcast, that I feel like women feel more shame
Mm,
about pooping, especially pooping in public, and they'll
yeah,
hold it longer. And
yeah.
I was like, I wonder if it's psychological, but you made it sound like it's from the beginning of even being potty trained.
Yeah, exactly. So it's both psychological but also from potty training. And then I think the one study that I love pointing out though is that I think it said that straight women and gay men are a lot more socially like conscious about going to the bathroom in public as compared to like, queer women or straight men whom will like teenage boys will run around farting in each other's faces. So it's
Oh,
like, so it's like they're not shy about it. But like, women are taught to be like, okay, don't poop, don't fart, hold everything in, and then you get fissures and hemorrhoids and all kinds of disasters.
lady, act like a lady,
Right,
you know?
exactly. It's unladylike to
Yeah.
poop or fart. Yeah,
It's actually natural and normal, and you should do it.
100, like 100%. You should do it. You know, go when you have to go and don't go when you don't. That's
Yes,
it.
exactly.
That's it.
Unless you really can't find a place. Like the other day, I had to go. I have to wait a little bit. Thankfully, I don't want
Yeah,
to go in the middle of somewhere, go in a
yeah,
toilet or the
yeah.
woods.
Okay, that's fair. That's fair.
Also, I'm still confused about the difference between laxative and stool softeners.
Yeah.
I know you kind of brought it up in your book, but it's for a layman like myself.
Yeah. So I think that, part of the confusion is that some people consider stool softeners under the big umbrella of laxatives because it has effects on your stool. But laxatives in general, I always just like very clearly tell my patients that there's two different kinds of laxatives, essentially osmotic laxatives and stimulants. Osmotic is the type like Miralax where it will draw more water into your stool to help make it sandier and waterier and help you go. And then stimulant is like Dulcolax or Senna. So these are actually making your colon or your rectum contract and push it out, right? So one's kind of mechanical and one's kind of physiologic. On the other hand, Colace or docusate sodium is a stool softener, and that actually just makes your stool more slippery. So it does also draw water in, and so it could kind of be an osmotic laxative, but it doesn't do as much. It doesn't, it hasn't been proven to draw as much water to be like a fully osmotic laxative, and so it just draws a little water in, makes it a little bit soapier and a little bit slipperier, and helps you go. So people will tell me like Colace doesn't work for them, and I've actually heard both things, like Colace doesn't work at all, or like Colace really works if I take 1 to 3 a day. I do think it also still depends on how much water you're drinking, because if there's no water in your system, there's no water for it to absorb to help you go. So you could take like 14 Colace a day, which I did have one patient do, and it still wouldn't do much.
Wow.
Yeah.
Wow. Yeah,
Fourteen.
I mean, you basically say it in your book over and over and over again. Fiber, not too much, lots of
Yeah,
water,
yeah.
exercise. Like that is the
Exercise.
perfect combination to making sure you're having a full elimination every day. But there
Yep.
are other things that can help.
Yep.
Um, I talking about the water part, I'm
Hmm.
still I try to drink enough water, but
Yeah.
as a 47-year-old middle-aged lady, my bladder can't handle it.
Yes.
And I have peed my pants on more occasions than I'd
Ugh.
ever like to admit. And so I was wondering, like, for me, I sometimes feel like I have a super, like, I was at Trader Joe's today and I felt like my bladder was super full. So I
Right.
went and got they have public bathrooms there. I went in to
Yes.
pee and realized as I'm peeing, I have to poop too. And I was
Ah,
wondering, like, where's the perfect, um, does the pee get so full it pushes poo out? Like, how am I hydrating enough, but also not peeing my pants, but having enough water for proper poo?
that's a good question. So, okay, I'm going to answer that in two ways. So, the first thing is it's related to the pelvic floor, right? So, this is like also the next book, probably like the majority of the pelvic floor stuff. But, I always tell people that the pelvic floor is like this. And so, the front is the bladder, the middle in women is, the uterus or vagina, and the back is the rectum. In men, there's just not that middle part. But when everything is loose, everything is loose. So like if you can't actually pee, like try to pee without also trying to poo. And if you're trying to hold in your pee, you tend to hold in your poo as well. So the muscles work, in tandem that way. So if you have a super full bladder and you're like opening up, your urethra to pee, technically not your urethra, but your urethra to pee, then most of the time if you have poo there, it will also poo. But generally speaking, you pee more times than you poo, right? In a day, right? Most people hopefully do.
And the
Like
way
six,
yes,
yeah,
a lot.
6 to 8 times versus like 1 to 3 times. And so if your rectum's empty, like there's not going to be poo coming out. But if there happens to be something there and your bladder's full, then both will come out. So that's the first part of the question. The second part of the question is, I totally hear you. It's not even just like, and you're not even old, 47 is like the new 30, but
Thank you.
I pee when I sneeze because of after childbirth. But if you're drinking so much water that you're, feel like you're peeing all the time and you're still feeling like you're not hydrated enough to have a good bowel movement, add electrolytes. Like this is the one thing that, I've actually learned even like mostly after writing the book. Adding, electrolytes, potassium, magnesium, things like that will help the water that you drink stay in your blood supply intravascular and actually help your colon absorb the water rather than you just peeing it all out, right? So you might have to drink a little bit less actually because you're adding more electrolytes, holding the volume for that like equal amount of volume of water. So
I do that. I used to try to drink about like 60 to 80 ounces a day. And I was like, no, I am peeing every 30 minutes. I can't function. And so
yeah,
now I'm peeing probably like 40 to 60 a day. And I put
okay,
electrolytes.
perfect.
So,
I mean,
yeah.
that's totally perfect. And then especially like if you're not like, in a hot climate or you're not like running around all day, like 60 ounces is totally fine with electrolytes for sure.
Cool.
Um, I see this one question. How do we treat skin tags for someone with Crohn's? Any difference than usual? Okay, so that's an interesting question. People with Crohn's tend to have or can have like perianal Crohn's disease. So very briefly, if you have skin tags and they're really true skin tags, I just cut them off. I just cut them off. But if it happens to be a skin tag where, there's also like an associated fistula, a lot of inflammation, and also like uncontrolled Crohn's disease, then I usually suggest, going on a biologic, staying on it for like a few months to a year, allowing the inflammation to go down, and then I cut it off. But not an uncommon thing to have, skin tags with Crohn's disease because you're going to the bathroom so many times a day and you're wiping so much. All of that wiping stretches out that tissue and
Yeah.
will cause more and more skin tags.
Oof. No
Yeah,
fun.
no fun.
Oof. Um, Where's another good question? Oh, I wanted to know because I don't know if you said this in the book.
Yeah,
I described that the colon and the intestines almost work like a snake, and
yeah,
that's how they pass things through. But
yeah.
is it when it's empty and there's no poo in the colon? Is it like an empty sock?
Yes.
Or okay,
No, I love that question because they sent it to me ahead of time and I was like, wow, I've been like doing this for 12, 13 years and I still don't realize that some people haven't held a colon in their hands and don't know what it feels like. It is like
never
an empty.
hold a colon in my hand. I'm glad there are people like you out there who do that. But Thank
I'm
you.
like, yeah, you squish it. It squishes like this. No, so I love that question. It's an empty sock. So when it's full, it's like a full sock. And when it's empty, like the walls collapse. And that's kind of the whole point. It doesn't collapse completely because there's like a little, a little lumen, like a little thickness to it. Um, but it does and can collapse. Like that's part of the problem because you're in contrast, what you said was like a hollow tube, right? Or
Yes.
like a pipe. So it's
Yeah.
not solid like that because it does move, it does change, and but more importantly, it stretches, right? So in some people, like if you have like really chronic constipation, your rectum and your sigmoid colon, that S part of your colon, can actually stretch and stretch and stretch and stretch to hold more and more poop, right? And eventually it can get a little too stretched out to be like, a little bit inefficient at pooping. Um, at the Mutter Museum in Philadelphia, the medical museum, there's
Yes, I've
a,
seen of
have
it.
you, have you been
Yeah,
there?
it's insane.
The guy with the toxic megacolon, they have a preserved version of it. He had 42 pounds, yeah, 42 pounds of poop in his belly, um, before he like died. But I mean, not that anybody here is going to die. It's just, that is a stretched out colon.
I mean, we used to tell people on the podcast, I think it's a 6 weeks. If you haven't pooped in 6 weeks, then it's really scary.
Oh, really, really bad. I mean, for me, 5 or 7 days is, enough to be like, you have to do something. I've seen people come in after 9 days, and I'm like, how are you not like, you know, in pain? And I mean, often they are, or like suffering a little bit. But my limit is, so my rule of thumb is 1 to 3 bowel movements, 1 to 3 times a day, right? And because that's like generally how much it goes in, kind of with the schedule of how often you eat, but then also with your circadian rhythm and your colonic rhythm. And so it's like 1 to 3 bowel movements, 1 to 3 times a day. If you've gone out over 3 or 4 days, then you should already be like trying to add a little more water.
Or so I know not to take laxatives anymore because I don't think that they're as good, and unless they're doctor prescribed. But
Yeah.
I always have suppositories,
Yeah.
and I travel with them because I get the kind of travel belly where I can't poop because I have
Yeah.
IBS-C, which
Yes.
there's a C for constipation,
Yes.
IBS-D for diarrhea, and
Correct.
IBS. I think it's say that again.
Oh no, I said correct. Yeah.
Yeah, and then
Yep.
there's the one that's like both. So you're
Mixed.
like,
Yep.
yeah.
Mixed. Yep.
And so I always bring suppositories with me just in case I need help because I'm somebody who, if I've gone 24 hours without a poo, I'm going to be uncomfortable
Yeah.
and I'm not happy.
Yeah.
But I think I even put like, maybe I had said this as a question, but sometimes there'll be days where, like, when I was on vacation in Mexico, I was pooping every day, but they were kind of small, not the greatest. I was drinking tequila,
Right.
not having many vegetables as I like to. I was eating papaya because I always tell people when you travel, eat some fruits. That'll help
Yeah.
things go along. But then as soon as I got home, the first day I was home, I think I pooped 4 times in like 2 hours. And it was massive coming out of me. And I was like, is this just all I've been holding in for the past like 6 days? Like, what? So is that part of my IBS? Is that just like how the body
Yes.
works sometimes?
Yeah. The answer is yes, like to both, which is that when you travel, right? So the travel is kind of like the trifecta of like, bad constipation things, which is dehydration. If you're out in the sun, you're on the beach, you're drinking alcohol, so you're dehydrated, you're not eating as well. And so 100% I agree with you. Like always find some fruit to eat, papaya, pineapple, whatever it is. But, fruit is always going to be your best friend there. It's like both fiber and water. And then sometimes if you're in a different time zone, your schedule's off, right? So if you're used to pooping at like 7 in the morning, and suddenly 7 in the morning is like 3 in the afternoon, you haven't slept in like 8 hours or whatever like that, and your body's like, what are we doing here? That throws you off completely. So that is one reason why you can't poop. You're also like not in your comfortable environment. I always forget to add that one, but when you're not in your comfortable environment, you're not in your own bathroom, you're like, I know that nobody can hear me or smell me or whatever, people will tend to try not to poop. So that's the first thing, and then the IBS-C is completely also part of the disease, right? So that you're having a little bit of anxiety, your belly is not responding the same way, and then all of things just kind of like add to it,
Yeah,
like
yeah.
confounding
Oh,
factors.
first. So yeah, then I have to get home and have a film elimination, which you even said in your book, Constipation Nation, that you said how that people always are like, coffee is what helps me to go.
Yeah.
And like, and you were like, no, it might not actually be the coffee and the caffeine. It's a
Yeah.
Pavlov response.
Yes.
And
Yeah.
yes, coffee does help me go. But what also helps me go is sometimes I could just sit down at my desk to start working. And I think my body goes, oh, wait, we're safe. We're home. We're going to be here for a while. Now you
Yes.
have to go within like 20 minutes. And so
Yeah.
I like this, the Pavlovian response and your colon being your second brain, I think is so true and so spot on of what you said in your book.
Yeah, I think the mind gut connection is huge. You know, Emma Mayer talked about it, and then there's actually another book coming out about it soon. But I think as we go on, we're going to find that your mind and your gut is, you know, more and more, or maybe completely related, right? So we already know that, you know, having an altered gut microbiome or dysbiosis can trigger things like cardiovascular disease, or, you know, skin conditions, hair conditions, but we also know that it's like very closely linked to like linked to anxiety, depression. And I love the little anecdote that, you know, when people say trust your gut, you really are trusting your gut because your gut is telling you something is wrong, right?
Yeah,
When everything is off.
yeah,
Yeah.
yeah. It's a crazy.
It
Um,
and cool though.
yeah, yeah, and cool. No, I love it. I mean, I obviously had a podcast about it for
About
5.
the entire thing, which is awesome. I
And I
mean, you.
literally like tell people, I've educated so many friends about stuff, and I'm like, trust me, I'm not a doctor, but I'm one level down from it, from the education I
Oh,
got
I
before.
know. I know. Like, and the thing is, like, you break it down and you can explain it to people in layman's terms. And I just think that you were out there kind of promoting gut health and being like, there's no shame in this, and that's so huge. I actually had one comment on TikTok the other day, and it kind of blew me away because it was somebody like completely anonymous. I don't know this person, is not one of my patients, but commented in my messages and said they didn't feel comfortable commenting in my post, but that they had bled for a year and then finally went to a doctor when they got like super anemic, but they were very embarrassed about talking about hemorrhoids and very embarrassed talking about hemorrhoidal bleeding and didn't want to see anybody. And so that's
Oh,
part of what we do, right? Is that we need to be like, hey, you know, if there's a problem, go see a doctor. Like, it's just your butt, you know, it's just
yeah.
poop.
And if you go to a colorectal surgeon, they've seen so many butts that even Dr. Fong, who saw my butt a couple of years ago, she doesn't remember my butt
I
because,
remember.
oh, okay, she does remember it.
I
But
remember every single butt
oh,
I
okay,
see.
she does. I was gonna say she doesn't remember it. Your butt's not special. She sees them all. So, but I guess a butt is like
Oh,
a face, got its own personality.
I see what you're saying. Okay, so in terms of, you know, you're not special and that everybody has hemorrhoids and everybody has anorectal disease, 100%. But I do remember butts like faces. That's just kind of a weird thing. That it's probably not true for everybody. Though, like I've worked with people who are like, yeah, butt's a butt. Like I'm not gonna remember it, but I don't know. I kind of
It
remember these things.
better doctor because you're actually in tune with somebody's butt.
Yeah, yeah, yeah. I'd be like, oh wait, when I can't remember you when you come in and see me in the office, but when I see your butt, I'm like, oh wait, yeah, I know you.
Like, you don't know your face, but oh, that asshole looks familiar.
Oh, that asshole.
um, I also had COVID a couple
Mm,
years ago and took one of the COVID medicines. I wrote it down in the notes and I can't pronounce it, but it wasn't Paxlovid. It was the M1.
right.
And I swear to God, I could not poop right for a year. Like it was
Yeah,
like a little too sticky and wasn't solid. And I had tried everything. The
yeah.
closest I got to having something decent was Pure for Men. Their fiber pills really
Oh,
helped.
really?
Um,
Hmm.
it wasn't until I had my colonoscopy
Yes.
and I almost like cleaned everything out. And then I
Yeah.
introduced BioK, which is like a really healthy yogurt laxative.
Right.
I mean, not yogurt, acidophilus shot.
Yes.
That
Yes.
right after that, I was pooping like I was getting awards for it. Like, and that was something that I feel like you brought a lot up in your book was that
Yeah.
different different like my aunt was schizophrenic and she was terribly constipated.
Yes. Yeah.
Different can happen to different people and you could be on some kind of medicine and it'll throw you off and
Yeah.
just talk to the doctor, get you there's different ways to get your gut back on track.
Yeah. No, the COVID, medications aren't ones that we have seen proven to cause, gastrointestinal changes, but I wouldn't doubt it because a lot of the antibiotics do, right? A lot of antiretrovirals do. And then, like you said, like a ton of medications do that we don't even think about. And we're like, oh, taking this, that. The most common one that I was really surprised by, because you're like, oh, I'm taking this for a stomach symptom, is Pepcid, right? Or like an antacid like Tums, while it does help soak up the acid, it also is a binder because it's calcium. And so it can actually constipate you if you're taking like 6 Tums a day and you're like, oh, it's for my belly pain, it's for my acid, but it might treat the acid, but then it causes like other literal downstream effects, which is binding you all up. The antiretrovirals, I think, is a super interesting thing though, because in antibiotics, not an uncommon story. Like you're sick for a long time, you even have like a cold or a flu, and then all of a sudden your gut is out of whack. You're like, oh, what are we doing? You don't know, but your body is processing, all the bad microbes in there, and you can have dysbiosis where all the bad microbes kind of, are higher in number, and then the good microbes are lower in number. And again, that same story, which is what you just said, as soon as you do a colonoscopy, right, it cleans it all out, basically does a reset, and then you start taking the good probiotics, yogurts, pills, whatever it is. I've also heard like a similar second type of story, which is that the colonoscopy, like the clean out, actually messes you up for a while, which can
Just your
also be true.
had that
Yeah,
you had bacteria in there, you
right.
watched. Oh, yeah.
Washed all the good bacteria out, which is, also what I mentioned in the book a little bit, like one of the reasons why that colonic cleanses aren't great if you do them regularly, because you're cleaning out all the good bacteria.
Yeah.
Yeah.
Yeah. I used to do those years ago and I realized I'm like, it's not really for me, especially because of my IBS.
Yeah. I like your suppository method. I do think like these days you probably could add a little Miralax to it because it's not
Okay.
addictive. But Miralax is a powder. The thing is with Miralax is that you have to take it with water. Same thing with everything else. If you don't take it with water, it literally turns into concrete in your colon. So I always tell people take a little Miralax, mix it with your water, drink it, and then chug a glass of water afterwards, and then it'll wash everything out.
Like psyllium husk too. Like I take psyllium husk pills, but I
Yeah.
don't. If you stir it into a glass of water, you have to chug it right there, or it
Yeah.
solidifies. And then
Exactly.
done chugging it, you just
Yeah.
drink more water to keep it so it doesn't keep solidifying in your stomach.
Yeah.
Yeah.
Okay. So that actually leads into my other favorite question that you asked, which is like the difference between soluble and insoluble fiber. So psyllium husk is proven to be like the best source of fiber in terms of, constipation. And it's because it actually does have both soluble and insoluble fiber. The way that you described it is perfect though, is that the soluble part gels, right? I always tell people if you look at an apple, the inside of an apple, the fleshy, meaty part, the white part is the soluble fiber, and the skin is the insoluble fiber. You actually need both. You actually
Ah,
need both for a good bowel movement. And a lot of times when we say fiber, we might actually focus on just the insoluble parts, being like, oh, eat more salad, eat more kale, eat more like celery, um, you know. But you actually need both. The skins, the insoluble part, cause a little irritation, like a mechanical irritation in your colon, which propels the stool forward. But the soluble part is what binds everything and actually like makes everything go down. So it's pectin in apples, but you can imagine other fruits have it too. Like pears are great, like tons of pectin, and then also the skin. Um, I think the confusion tends to be most things actually have both, like soluble and insoluble fiber. So now instead of being like, oh, go eat, a ton of salad, I'm like, get a good mix of soluble and insoluble fiber. Sweet potatoes are great, both soluble and insoluble. Apples are great. Like riper bananas are great, both soluble and insoluble fiber and potassium, as an electrolyte.
That's awesome.
Yes,
Yeah,
diet is super important.
I always say eat an apple a day and keep the poopy saying, hey.
Yay! That's a good one. That's a good one. But I mean,
um,
I want to go, eat an apple a day and literally keep the doctor away, hopefully. So,
keep the doctor away, keep the poopy saying, hey. um, I also love that you said in the book that we spend $1.6 billion treating chronic constipation a year.
mm-hmm.
I
Yeah,
mean, for all those out there who are like, we got to stop spending money on things. And just that, and if you read your book, you won't have
yeah,
to spend all that money to
yeah.
try to um not you're not curing constipation, as you say in your book. We want to prevent
We
it.
want to prevent it. Yeah. I'm always like, this is like less than the price of a copay. My copay is like $40 when I go to the doctor, right? So for less than the price of a copay, you could prevent the majority, about 80 to 89% of constipation can be prevented just by being on a better diet. I know people hate to hear it because it's like, pills are easier and like, doing a laxative is easier. And, sometimes you can do all you can do with your diet and your water and your exercise and it still doesn't work, and then you do need other things. You do need like, lubiprostone or Linzess or some more laxatives and stuff. But 80 to 89% of people can have their constipation prevented. $1.6 billion. That's like half of our currently non-existent education budget. But then and imagine how much money we spend on healthcare in general, and like all of that goes towards constipation.
No, but that's what healthcare should be more about, not just with constipation and our
Yeah,
bowels. We should be doing things to prevent
yeah.
instead of worrying about the cure.
Yeah, and yes, 100%. I think if we prevented it, you wouldn't be seeing the doctor, you wouldn't be like having hemorrhoids, put me out of business. I
Yes,
love it.
exactly. I also wanted to talk about your fabulous recipe in the book that
Oh
you
yeah.
talked about in an earlier chapter. And then I started going, where's this recipe? Where's this recipe? And like I flipped to it and I was like, I am making this because I read this book on vacation. I was like, the
Yeah.
minute I come home, I'm making this. And because I did the blue poop challenge that you also talk
Yep.
about in your book, I know that my from mouth to ass
Yeah.
is about 42 hours. Um,
32? Okay.
42.
Oh, 42. Yeah, okay.
Yeah, about give
Yep.
or take the day, and if I had
Mm-hmm.
too much tequila the night before. But
Right.
yes, it's about 42. So not only can I tell everybody buy this book just even for that recipe for poop, the ultimate poop soup, which I was
Yeah.
like, a funny uh, name for a
Word.
soup.
Oh, I know.
Yeah, and I was like, I made my poop soup. It has nothing. There's no poop in it, but it was delicious. It's basically chicken meatballs and
Yep.
a chicken broth with spinach and egg drops.
Yeah.
It was insanely delicious. I'm making it again,
Yeah.
but I pooped about the 42 hours later.
Yeah.
And I swear to God, it was like world record, beautiful. It was like 14 inches long, fell out of me, zero
Ta-da!
thing. And I did it in a restaurant too, where I was just like, oh my God, why do I have to poop now? Of course. And I was in and out like that. Um,
Yeah.
so yes, I'm just saying, if the only reason to gift this book for Mother's Day or Father's Day, it's for that recipe that you came up with yourself.
I did. And I know the poop soup, I was like debating that for a long time if I should call it poop soup. I was like, I can't help it. It's poop soup. So, I based it on, it seems like a non sequitur now, but my grandmother used to have a recipe for sweet potato soup. And so I was like, well, sweet potatoes in soup makes you go, right? But I was like, but I could put other things in soup that are like fiber, fiber rich, but also like very clean, right? So like you make your own chicken meatballs, you add a little bit of egg drops for the protein, and then there's just tons of fiber and there's tons of fluids. And I made it a couple times and my kids love it. So if you
It's
guys ever need something that your kids will eat, like they will eat this. Like I have no idea why, but it's like easy to eat or something. It's good. It tastes good, and it does seem to work. Like it's a pretty clean meal.
no, it works really well. It was delicious and it's very easy. Like if some people are not really good about following recipes, this was really easy to follow and really quick and easy.
Yeah, I have somebody saying fan of the book. Discuss these things absolutely. Um, you must have felt so relieved. The big poop. You know, I know you talk a lot about this, but like, what is your ideal poop? And then I'm going to answer this question about the constipation. What is your ideal poop?
Me?
Mm-hmm.
I will call it a no push, no wipe. So it like
Yes.
literally
Yes.
falls out of you. It's like the Bristol stool 4, the
Yep.
perfect 4. I
Yep.
want it to be like almost no cracks in it. And I want to almost like sit down on the toilet and it slides out of me so quickly that I think it was barely there. And then I look at the toilet and I'm like, oh, how did
Look at
that come out of me?
right. Yeah.
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 So I
Yeah.
want it to be as stress free as possible. Just like
Right.
whoop, slide like a water park slide,
Yeah.
whoop,
Yeah.
right out.
I
Yeah.
love that, like no poop, no wipe. I knew you would know, because and Bristol stool scale 4 is perfect, but the important part to me is the no wipe, and I think people don't realize this is that if it's a good poop, it will actually stretch out your anus, right? Stretch out the muscles, come out, and then your anus actually closes or like pinches it off afterwards because there's nothing left, and so you're not like stuck there wiping for hours because it's like sticky or watery or hard. Um, and that's part of the reason why your anus cleans itself really well is that when it's a good poop, there's not that much to clean up.
Oh, and I love what you said that in your book, that treat your butt like you would your mouth. You don't put
Yeah.
soap in your mouth. And so
Hmm.
I said that to somebody and they're like, so are you supposed to put toothpaste in your butt? And I was like, no, it's like, no, water, like you can clean,
Okay,
like if you're
fine.
in the shower and you get a little soap on your butthole, that's fine. But
Yeah.
it's not constantly wiping it, especially baby wipes. I tell everybody stop with the baby wipes. They're the
Yeah.
worst thing for you. They're horrible for the pipes. You're
Yeah.
gonna have if you own your home, that's like a recipe for disaster. So
Yeah.
don't do it.
Yeah.
But I love that you put that in your book.
Yeah. No, and the wipes though, it's like bad for the septic tanks, bad for the environment. And I always tell people like they work really well on babies' butts because babies' butts don't have a lot of wrinkles when you come out. They're pretty flat and smooth. But your butt is almost never like a baby's butt, like ever again, because like you use it. You use it for the rest of your life. And so wipes don't work as well on it because it's harder to get in those wrinkles. So if you can, bidet is the way.
Yes.
And bidet is the way. Or if you can't, do some kind of like wet toilet paper or like some kind of cleansing foam, cleansing liquid. All of those things are out there these days that I prefer over wipes.
Yes, 100%. And wipes also have like chemicals in it that are bad for your
Yes.
pH and
Yes.
then cause fissures, will cause problems down there. So stay
Yes.
away from them.
Yes. And like skin irritation, itchy anus is one of the really common things I see from frequent wipe use, pruritus ani. All right. So quickly,
I see
Amy
the
asked a question.
bamboo
Oh,
toilet paper question.
oh, is there a
I
bamboo toilet?
personally love bamboo toilet paper.
Bamboo. Oh yeah, bamboo. Yeah. So I actually found this like bamboo toilet paper that is like, really, really good. And it's super expensive though, so I don't think you have to do it, but if you can, absolutely. They tend to be tree free, like non-toxic, they don't have like weird chemicals in them. So that's definitely true. Is using the bathroom the same after getting a BBL? It should be. So BBL doesn't affect your butthole or your rectum. It's just your butt cheeks. If you're having like a huge butt put in, maybe you you have a little more padding when you sit there, but it should not affect your pooping. Is bleaching the butthole okay? Interesting. So there is this whole thing out there, right? Which Ellen knows about.
And my
um,
the podcast actually bleached his butthole
yes,
live on the podcast. So yes,
yeah,
it does
yeah.
happen.
It does happen, and this anal rejuvenation is a whole thing, right? So the answer is yes, it's okay. You know, I wouldn't do it often because it does cause skin irritation. And the third answer is you don't need to. Like, why would you need to bleach your butthole? You know, it's kind of like parts of your skin are darker than the other. Your butthole is supposed to be darker than everything else. You don't, it doesn't need to be pure white. It doesn't need to look like a baby's butt.
But also, who's down there going?
Apparently, a lot of people, you know, like the people I
But
talk to, it's
besides
like,
you, Dr. Fong, you're the only one
oh,
who's like looking at it.
yeah,
Like,
okay.
but I'm like, who's looking? Who's staring that long and going? I wish it was a shade lighter.
Yeah,
Like,
I know. Ain't nobody looking at your butthole like that. You know, like even people who tell me they're like, oh, you know, I'm having new partners, you know, I want to be confident during sex. I get it, you know, like I want you to be confident, but nobody's spending that much time looking at it. I promise. I promise. Like
yes,
people have their skin tags removed for their partners, and I'm always like, if you're gonna do that, make them remove theirs too. So
yes, tit for tat.
tit for tat. Yeah, no,
Yes,
do it if you must, but you really don't need to, and don't do it a lot because it will get irritated.
yes. I feel like unless you wanna go through my questions, if I hit all of them, but I want to say, besides the fact that I had a podcast, Hey Poopy, for so long that was obsessed with everything the butt does, I'm also dyslexic and I'm a very slow reader. And so this book, I brought it on vacation, was not only an enjoyable, fun, interesting read, but it was not hard for me being dyslexic. And I was so proud of myself for reading almost
Oh,
on vacation for the first time in a very long time. Because, and so I would suggest this book to anybody because yes, it's coming from a doctor who knows more about buttholes and more about colons than all of us could ever imagine. But you write it in a way that makes it easy and palatable and enjoyable. So thank you so much. Like,
no, I'm proud of you, and you should be proud of yourself. Thank you for that. That was super important to me that I, you know, say it in kind of like a, you know, understandable way. I still got some comments on Goodreads that it was a little technical, and I think I do end up getting a little technical in parts, but I can't help it. But the majority of it, I think, is pretty readable.
like I don't mind the technical stuff because you're a doctor. I
Yeah,
want that, you
right.
know?
You want that information, right?
Yeah. And if I got really confused, I would just Google something really quick and I was like, oh yeah, okay, yeah, yeah, yeah. Like
Right.
it's not, and as a dyslexic person, if I see a big word, my brain goes, just skip it. It's okay. You'll figure it out. You know,
Yeah.
like so some of the technical stuff I was okay with. Somebody
Context.
asked
Oh,
the ashwagandha,
yeah.
which I take every day.
Ashwagandha is good. It's supposed to be anti-inflammatory. Hasn't really, I haven't seen any evidence that it works for pooping or constipation, but I believe you 100% anything that's anti-inflammatory. The other question though is flaxseed, and flaxseed is 100% good for constipation. So, you know, like chia seeds, like flax seeds, like psyllium husk, you know, these have both soluble and insoluble fibers. So you can actually get ground flaxseed that you can just put on top of your oatmeal, your salads, wherever, put it in your smoothies. Flax seeds are 100% good. Okay,
Yeah.
and then so that quick, oh, sorry, go ahead.
I put a teaspoon of ground flaxseed into my protein shake, and the next day I make beautiful Bristols.
Beautiful poops, yeah. I mean, I would say that the top three things, if you're going natural, honestly, should be psyllium husk, flaxseed, and chia seeds.
And,
Kombucha, what was that?
and kiwis.
Yes, and kiwis, yes. Well, and all fruits, honestly. You know, I just love fruit, so it's like you can't go wrong. Coconut cult. So I did try coconut cult on my TikTok, and I thought it was pretty good. Have you heard of coconut cult?
I've not heard of this.
Oh, you have to try it. So it's like this like all natural coconut yogurt, but it has like all these strains of good probiotics in it. And you know, for me, I always look at the label to see which probiotic strains are in it. A lot of the common ones that are out there, like the popular name brand, like probiotic yogurts, literally and only have one strain. But you have to have a good mix of strains, and you have to have lactobacillus, bifidobacterium, and usually like a bacilli species. And this one has all three. I took it, and I thought it was actually really good.
Oh, that's
So
awesome.
you have to try it. All right, guys, it is 10 o'clock. I'm gonna answer like these three last questions. I don't want to keep Ellen too long. We can totally do this again. We can keep doing this. Yay! What's the role of hydration in constipation? How much water should I drink? Hydration is 100% important. You need to hydrate the actual stool in your colon, so it has to draw in water to help you poop. For a regular person, you should be drinking about 2 liters a day. If you're in a hot climate, or if you're super active, or if you're pregnant, it should be about 3 liters. Is it the girl yogurt coconut cult? It's not girl yogurt. I think it's everybody's yogurt. I I have the strawberry flavor, and it's really, really good. It's pink.
Ooh.
Uh, Bloom's probiotic green superfoods. Those are both good. What are good foods? Sweet potatoes and broccoli. And then, so Amy had a quick question earlier, which is not a quick question, but are there different types of constipation? And the answer is yes, right? So Ellen talked about having IBS-C, so the irritable bowel syndrome constipation type. But within constipation itself, you can have slow transit constipation, which is that the colon doesn't move well. You can have functional constipation, which is the colon is moving fine, but you just haven't really been optimized with diet, activity, water. And then you can have an outlet obstruction. There's a lot of different names for this these days, but essentially colon moves food through, and the anus is the outlet. So if the colon's moving but the outlet isn't open, you can also not poop. So whenever I talk to patients about constipation in the office, I always make sure that there's 2 different things going on, and if we're going down the path of diagnosis, we really have to work up both colon dysmotility and outlet dysfunction. Coconut helps with pregnancy, so it can, because of the good strains of probiotics, but that is definitely one I would check with your doctor, because if you have any kind of immune compromise, or pregnancy in and of itself sometimes causes some immune compromise, you might get sick with live probiotic strains. So that's when I would check with your doctor. Great. Okay, cool. Marvin the professor. All right. Anything else for me?
No, just everybody buy this book. Buy one for your mother for Mother's Day. Buy one for your father for Father's Day. It is a great read, and it will save buttholes.
But saving buttholes one at a time. Thank you so much, Ellen.
You are amazing. You're doing God's work. Thank you.
No. But honestly, if you ever relaunch Hey Poopy, let me know. I will tell everybody to come listen to it. So
I even wore my toilet paper earrings for that.
you did. Oh my God, that's so cute.
Isn't that adorable? A friend
I
of mine
love
gifted
that.
them, and he was like, I saw these and I knew you had to have
Oh
them.
my God, those are so cute. My like butt and gut paraphernalia like kind of takes up a whole shelf in this room. Yeah, so
I
this
bet.
is going to be, I think this is going to be recorded, and we will post it on Instagram, and then also on Facebook, and I think also on YouTube. But definitely we'll do this again soon.
Yeah, I would love to put it on our YouTube, which is pretty popular. Hey Poopy's YouTube.
Yes, absolutely.
Yeah,
So I will send you a link whenever I can. Thank you so
perfect.
much.
You're amazing, Dr. Fong.
You're
Thank you.
amazing. Thank you so much for
And
doing
thank you
this.
for writing such an incredible book.
Thank you. I like the cover. I don't know.
I
All right. All right. Have a good night.
You too.
Bye.
Bye.
How do I close?